Tigray People's Liberation Front was formed on February 18, 1975 to lead an armed resistance against the Derg, a military government that would inflict unimaginable damage on Ethiopians everywhere. Over a course of 17 years, TPLF would mobilize Tigrayans everywhere to feed into a people's revolution that would overthrow the Derg. But its resistance against poverty and towards human development would start much earlier. Just a few years into its establishment, TPLF would start to develop policies around education, land ownership, and healthcare in liberated areas across Tigray. The TPLF developed the Baito health system to address basic needs in Tigray. Baitos were structures composed of elected local governments at the district level. These Baitos were institutions for public participation and accountability for the TPLF. The Baitos would build health stations consisting of an average of 10 rooms, including delivery and emergency rooms for the community. The Baitos would also mobilize to raise funds for drugs and medical equipment. Since the shortage of healthcare workers and the health stations had become a hindrance, the TPLF would found Rahwa Nursing School. The local Baitos, together with public relation officers of the TPLF, would then recruit people from the population for trainings. In addition to the training programs, the Department of Health had two publications, T'ana or Health, which was aimed at healthcare workers, and Mikilkhal or Prevention for the public. Prevention covered topics such as control of malaria, AIDS prevention, personal and public hygiene, and first aid treatment. In a meeting in 1987, after hearing arguments about whether to focus on curing diseases or on preventing them, it was decided that the health system would be primarily focused on prevention. It was also during this meeting that the health system was decided to be democratic and revolutionary, where people could participate directly through the local baitos and new ideas could be raised from the people rather than coming down from higher ups. Dr. Gabrab Barnabas, former head of the Tigray Bureau of Health and a member of the then TPLF Health Department, says that the Baito health system was the first in the history of the country to implement primary health care and in fact was working to achieve the Al-Ma'ata Health for All Declaration of 1978.
There was a worldwide movement initiated by WHO and UNICEF in Almaty, which is currently in Kazakhstan, in 1978. They launched Health for All by the year 2000. And at that time, Tigray was at war with its own central government. It was a military dictatorship, but we were trying to develop a new healthcare system based on the Health for All by the year 2000 in wartime. The primary health care in wartime did tally with the policies of the military regime. They also adopted primary health care, but they never implemented it. They failed. The difference was here. We implemented primary health care in wartime and later in peacetime. The previous regimes, including the imperial regime and the military regime, failed to implement it. The military regime that took over had no idea about what is a progressive, public-oriented health system. They continued the doctor-based, hospital-based, disease-oriented health system, even though on policy level they said we support health for all by the year 2000. So for the first time in Ethiopia, primary health care was implemented in wartime.
After deciding that the health system was primarily to be preventive, specific strategies to implement those policies were formulated. The Baitos were to play the leading role in delivery of healthcare. The preventive approach was to be the priority alongside improving the quality of curative services. Health service delivery was to give greater priority to the lower echelons of the healthcare system than the hospital level. Training for health workers was prioritized. The curricula selected were required to be relevant and practical. An essential drug list was established, as were rules regarding the storage, distribution, and utilization of drugs. Free treatment was made available for war injuries, medical and surgical emergencies, deliveries, and epidemic diseases. For other conditions, those able to pay were expected to do so. Private sector pharmacies, clinics, and hospitals were allowed, but had to be certified by the Department of Health and licensed by the BITO Trade and Commerce Committee. International support was recognized as important, but had to be subservient to local policies and initiatives, and all NGOs had to sign a multi-party agreement with local BITOs, Relief Society of Tigray, and the Department of Health. The Department of Health were restructured to facilitate collective leadership, as well as the periodic draft of a plan of action and regular evaluation. Health Department of the TPLF was also engaged in controlling epidemic diseases like malaria by providing chloroquine tablets to pregnant women, children under the age of 5, and patients with chronic illnesses. There were also a campaign every September to clean houses and dry swamps since there were no insecticides. The concepts of the BITO health system continued to be practiced after the overthrow of the Derg as well. In 2003, the Health Extension Service was launched with more than 30,000 women trained and placed in health posts in their vicinities.
About 5 years ago, the Ethiopian government launched a program which is called the Health Extension Program, which is another name for primary health care. A program which started by training 30,000 female health extension workers nationally. For Tigray, this came about 1,800 female health extension workers. And then the Global Fund, UNICEF, and other partners like the FID, also USAID, all contributed towards building structures like health centers. There are now 3,200 health centers being built with the help of the Global Fund, 50% contributed by the Ethiopian government and 50% by the donors.
The concept of health extension program was developed by former Prime Minister Meles Zenawi and aimed at providing health care to pregnant women and infants.
Ethiopia's added 35,000 new health workers, and they're all over the country available to help out with basic health needs. And it's making a big difference in helping mothers do the right things with newborns, helping with infectious disease and sanitation. It's a system that they keep trying to improve because they're very serious about having Ethiopia be a healthier place. The key thing in a health system for a poor country is access, having nearby what are called primary health centers, and having people who have the right drugs and the right training to help you out with the things that need to be nearby. The lowest level, the primary health care center, is called the health post in Ethiopia. And these are very new. They've been staffed by 2 young women each, so they've put out 15,000 of these posts, 30,000 women trained in about 16 different areas. The ideal in a health post is you know your community so well that you have a registry of all the pregnant women and you have knowledge of when they're likely to deliver, and you're going out and talking to them during their pregnancy. And you have the vaccines in stock, and so after the children are born, you're going to be available. So you have both supply and demand matched up. And then we went to the next level up, the health center, where they have the ability to do a little bit of surgery. They have more drugs, more expertise. Sometimes there'll be a doctor at that level, not always. And the health center manages 5 of these health outposts. It really is a model system.
The health system model, inherited from the time of armed resistance, would be large-scaled after the overthrow of the Derg, with a rapid expansion of primary health care across Ethiopia. The health system in Tigray would show a rapid improvement from just 4 hospitals in 1991 under the Derg regime to 716 health posts, 212 health centers, and 41 hospitals in 2018. The number of health workers would also show a rapid increase from just over 17,000 to 140,000 medical workers in 2018. A health system built over 40 years of concentrated effort and investment was the target of deliberate and systematic destruction by allied Ethiopian and Eritrean forces over the past year. If health facilities were not the target of deliberate physical destruction, the almost 8 months long siege on the region that has blocked off all medical supplies has meant that patients have no access to medication or vaccination. But Dr. Gabriel Barnabas, former head of Tigray's Bureau of Health, says not all is lost, and years of dedicated investment promises a quick and effective recovery for Tigray's health system.
They might have looted our infrastructure, the equipment, and the buildings, but they cannot break our will. Our will remains, and in fact, we are iron-willed people. The people of Tigray are iron-willed, and when peace resumes in a very short period of time, not, to my estimate, not more than five, we will go back to the pre-war, pre-invasion status. We also reckon or expect our former partners to help out financially, technically, if they can, but we will do it on our own if they don't.